Well, hello and welcome to Ask the Doctor. My name's Jerry McGee and I'll be your host for today's show. We're down here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. And Dr. Goldberg, thank you very much for your time today. I really appreciate it. And on today's episode, we actually had a viewer write in with a question about fibromyalgia. They've been dealing with kind of all over body pain for a while. They've been in and out of seeing various physicians. No real improvement with anything. Nobody really able to give them any type of real, something that made a difference for them. But they keep linking them into this thing called fibromyalgia. And they wanted to know, is there anything that chiropractic care can do in regards to fibromyalgia?
We take a little bit of a different approach here. We look at fibromyalgia, basically it means a fancy way of saying pain throughout your whole body. Mm-hmm. So if you have pain throughout your whole body, we want to ask why. Usually it's a pinched nerve. See, if you have pain, pins and needles, numbness, or burning. Of course, they don't have all four of those. But if you have any of those symptoms, we live in a cause and effect universe. There has to be a cause. 9 times out of 10, in my experience, after close to 30 years, it's a pinched nerve. So if you correct the pinched nerve, a drug will not correct the pinched nerve. The only way, Jerry, a drug will correct the pinched nerve is if a little chiropractor came out of the drug and adjusted their spine. It's a joke, but it's true.
Right.
Okay, like people see on TV, they see Doan's pills for their pain in their back. Usually fibromyalgia, there's 15 points on their body that are painful. Mm-hmm. So if you take a Doan's pill, no little chiropractor is going to come out of the Doan's pill and adjust your spine. You have to get an adjustment.
I don't know when we got to this point in our healthcare system where it was like everything had to be cured by a drug. It's a
medical model.
Right, and I think right now when we look at, because I've talked to several people in regards to this fibromyalgia diagnosis, and really a lot of them are discouraged. They're they don't feel confident in the diagnosis. It's almost like they've just been thrown into it because the physician might not have really known what the problem was. So instead of saying and being honest maybe and saying, truthfully, I don't know what the problem is, maybe we need to look at some alternative methods of treatment such as chiropractic.
Well, that's sad to me because if you don't know the cause of something, right, you're not going to cure it. If you're a plumber and you don't know what the cause of the plumbing is, how are you going to cure the plumbing or the electricity? Same thing.
Yeah, but I see, from the people I've talked to, I see a lot of them going down that road. It's
that's
like,
sad.
We don't know what it is, so let's just, and fibromyalgia seems to be kind of that catch-all, terminology. Mm-hmm. So, and then of course it is, treated with medication.
My understanding, Jerry, it's 13.7 million people in America have fibromyalgia. It's number 3 behind osteoarthritis and rheumatoid arthritis. So, you can look at it and say, hey, it's a big money maker for the drug companies now. Right. So what they do is they come up with the drug first and they match it to the disease. So they came up with the disease fibromyalgia to say, hey, we got a drug for that now. Mm-hmm. So everybody's happy, except for the patient, of course, because it doesn't cure them.
Because a lot of these people dealing with fibromyalgia really do have a fair amount of discomfort.
Have pain,
Right. It's not. We're not saying at all that this is something that they're making up. This is something that is painful. But what I really like about coming down and meeting with you and talking about this is that when you're dealing with the chiropractic community, you're really trying to get to, all right, we got a problem. What truly is the cause? Let's not mask the problem. Let's actually try to find what the cause is and go at the cause versus masking some type of symptom.
That's what I like to do. Like, for instance, you live your life through your nervous system. You're connected to the universe by your hips. So therefore, if you have a pinched nerve, that's affecting that cell, that organ, that muscle. Okay, the muscle is the effect. Yeah, they have tight muscles, they have pain in the muscles. Fibromyalgia means most of their pain's in the muscle. So if your pain's in the muscle, why is there the pain? Usually it's a pinched nerve. Okay, build up of lactic acid. So you can do trigger point therapy, you can do massage, you can do chiropractic, which helps the pinched nerve. This is the pinched nerve. Mm-hmm. That nerve tells the muscle to fire, it's tight, and then of course you can take a drug, a muscle relaxer, but as soon as the drug wears off, you still have the muscle spasm. You're not getting to the root cause of the problem.
So really, you get into this just kind of cycle where maybe you have some period of decreased pain because you're masking it with some powerful medication.
Right.
Then that just kind of and a lot of people are in this cycle. Right. They never really get out of it. Then they get to the point where they're forced into disability and all these other things when it doesn't have to be the road they have to take. And, I think one of the things that we really want to stress to everybody watching is that in today especially, it's vital that we take an active role in our healthcare.
I think so.
Right? Instead of somebody, just going in and just randomly letting somebody dictate to us how to best handle our health. We've got to stop just listening to everybody. Start doing some research. Start looking at some alternatives.
Go on the internet.
You know, I mean, yeah, today the information age is there, but you know, too many people, and I talk to a lot of people who are this way. As soon as you start to mention some type of alternative method, they're like, well, my doctor said I shouldn't do anything like that. They put all their faith in one doctor who more than likely is not up on everything. And you know, as a matter of fact, I saw a stat where by the time you get out of medical school, and within a 5-year period, everything you've learned is pretty much outdated.
That's true.
And now the one thing that really, for lack of a better word, aggravates me is the article then went on to say that the training of these physicians was done by who? The drug reps.
There you go.
Okay? Training a physician on the use of a drug versus let's really look at what the root cause is.
That reminds me of the wolves guarding the hen house. Well, of course, that if a drug company is sponsoring a seminar, if the drug companies are sponsoring the medical education, of course, they're going to poo-poo the alternatives. Why? There's no money in for the drug companies.
Yeah.
So it's kind of like one cause, one cure. One cause germs, one cure drug. So if you're outside that model, it's like a foreign language to them. So if you mentioned chiropractic, Ayurvedic medicine, Chinese medicine, acupuncture, exercise, diet, nutrition, lifestyle, and you mention that to your PCP, they're going to look at you like you have 3 heads, Jerry.
Yeah. Well, you know, for everybody watching this video, we really want to get that across to you that, you know, there are alternative methods. There are great forms of treatment that can help with whatever problem you're dealing with right now. So if you've been struggling with fibromyalgia and been maybe going from doctor to doctor looking for that, that cure or that treatment program that's going to work for you, we encourage you to pick up the phone, give Dr. Goldberg a call down here at Wellness Associates. And just come down, and what I really like about what you do is you offer a free evaluation for somebody to come down and just kind of see what you do, make sure they are a good client for chiropractic
Good
care.
Candidate, good candidate.
And come in and really kind of understand what this is all about. And I think you're going to be amazed if you take the time to do that and come in and meet with Dr. Goldberg and the other people here at Wellness Associates. I think you're going to find that you're going to see some relief. You're going to see some positive results. And that's what this show is all about, educating the public and the consumers that there are options. Take a vital role in your own health. Take responsibility for it. And we can really just appreciate you watching our videos, enjoying this show. And if there's anything that's bothering you, feel free to visit the AskDrGoldberg.com site. Click on Ask the Doctor. Enter your question just like this and let us address it. I think you'll find some great information and a great answer to what your problem is, and really a truthful answer to what the options are. So thank you very much for watching, and we look forward to seeing you on our next episode.